And welcome back. This is my first solo interview, and I would like to thank Mr. Daniel Sweet here, Dr. Daniel Sweet. He will be my first interview. Now, Dr. Sweet has been in Clovis since 1981. And what brought you to Clovis?
Oh, that's a tough one. I went to school in San Francisco, and I just worked my way down California, and Clovis was great. Housing, the people, I just loved the place.
Fantastic. Now, has your office been in the same location since you first opened?
Interestingly enough, we started there on Sean Fowler, and in 1998, we moved over to our new facility, which is basically almost across the street. I mean, if you're a good baseball player, you could probably throw a baseball over there.
Fantastic. Now, what do you see every day that is a common problem for people with their dental?
You know, I'm still always amazed at people that use hard toothbrushes. Because
why do they make hard toothbrushes if it's so bad?
That's a good question. People buy them. Actually, they even changed the name of them. Now when you go into the drugstore, they don't put the word hard. They use like firm or something like that, but they've kind of changed the name. But I kind
of the best one to use would be.
Yeah, I'm going to actually show you because
okay, great.
Because the harder brushes actually pull your gums back.
Oh, okay.
Now, Gary, I mean, feel these two.
All right. Ooh, that's super stiff.
Yeah, you feel the difference. This this one would be good to clean your shower with. Go over the grout, that kind of thing.
Wow. Or polish your shoes.
Polish your shoes.
Yeah.
Tennis shoes, that'd be good for this.
Yeah.
This one is good for your teeth. Nice and soft, gets in all the crevices. That's what you want. This is what our hygienist gives us.
And now you were talking about the gums. What exactly is it that the soft toothbrush does that that the hard one or the firm does different?
Two things. Number one, the bristles flex and get in all the little crevices.
Okay.
But it's also important what it doesn't do, and that's kind of pull your gums back and cause abrasion.
All right.
So it's kind of a little bit of both.
So the firm ones will actually damage your gums.
Yeah, over a long period of time. Because muscle. You're
right.
sitting there, scrubbing away for years. You're gonna definitely pull something back, damage something.
And does that leave like a scarring, or does it expose?
Oh yeah, all the
roots,
time. Yeah, you can have sensitivity on your roots. You can have. You've heard the term. I think it's a Chinese term, long in the tooth.
Right.
Well, you don't want to be long in the tooth. That's long in the tooth means your gum is receded.
Oh, okay. And
usually when you're older.
And it can be caused by that particular firm.
Could be caused by
that. Could be caused by that.
Yeah.
Right?
Now, do we have time to cover a few more?
Absolutely, absolutely. What else would you like to show us here?
I'd like to, speaking of things like that, another thing people don't realize is I have 3 products here I just grabbed off the shelf.
Right.
Guess what these 3 have in common?
You put them in your mouth.
Good. That's a good one.
All right.
But also, they don't have any alcohol in them.
Oh. Okay.
Now, alcohol is a drying agent.
Yes, it is.
So you use a mouthwash, for example, Listerine or something. That's like using 46 proof alcoholic drink.
Wow.
So it dries your mouth out. It doesn't do you any good. A lot of people taking medications already have a dry mouth problem, and that just makes it worse. Dry mouth is bad.
That's very interesting. I did not realize how much alcohol was in the mouthwashes.
Yeah, no, this company, this is for people with dry mouth. It keeps the saliva going.
That is great.
Dry mouth, you're gonna get more cavities. You're gonna have a lot more problems. Also, I'd like to say if you're somebody that is on chemotherapy or getting radiation treatment, make sure you talk to your dentist about it, because you have to get some big time prescription stuff.
Oh, that's quite interesting. I didn't know that. What else do you have to show us here?
Let's see. What else do we have here? This, something new. It's really nice. You probably can't see too well, but This
We
is
can zoom in on it a little
we
bit.
can zoom in.
Yeah.
This is metal-free dentistry.
Go ahead and lift it up just a little bit here. There you go.
What's nice about this actually is a zirconium product.
It is.
Zirconium. And now you've probably heard the term zirconium.
Right.
It's the same family as cubic zirconium,
All right.
which is the jewelry.
Right.
So this is the same family of products. Now we use it to make teeth. They're very nice. They have no metal
Well,
in them.
cubic zirconia is extremely hard too.
Oh,
so
it's hard as a rock.
Yeah, right.
And it looks beautiful. You don't have any graying on your gum line.
Wow.
Really nice new ceramic products in the dental world.
Wow.
Very exciting. Very, very nice to use and look fabulous.
And you do these as a regular procedure in your office?
Sure, sure.
Oh, that's
yeah.
fantastic.
Yeah, and a lot of dentists in town. There's a lot of good dentists in the Fresno Madera Dental Society.
Now, we had a little interactive question from one of our viewers, and they were asking if you ever find some of your new patients think it's a little ironic that your name is Dr. Sweet.
Yes, I get that all the time. Actually, people have asked me if I actually changed my name.
Oh, really?
And, yeah,
Really?
Seriously, people have asked me that, and actually, it probably wouldn't have been a bad idea, but the names work good for me.
Yeah, I would imagine that.
I've enjoyed it.
Yeah. Now, one of the things I'd like to say real quick is that I have been able to be your account manager actually for the last 2 years, and I represent my company go in, and your office is always so fantastic. Everybody's professional, completely dependable, reliable, and they're always there on the spot when I come in. I see how they handle the patients, but you also created a quite nice, relaxing atmosphere in there.
Oh, thanks.
It's one of the things that I just noticed when I was in there. It is something that just keeps you calm and relaxed, and it's a nice little setup in there.
Okay, thank you.
I really think
Appreciate
it's a beautiful office.
Appreciate it.
Anyhow, I didn't mean to interrupt. What else did you have
no,
to show
go
us?
ahead. I just want to make sure we get this in. There are a lot of people out there, maybe your parents or somebody. This is kind of not the greatest, but I wanted to talk a little bit about dentures and implants.
Okay.
And I'm sure you see all the advertisements on TV for
Fix it in,
sticky
all that kind of
stuff.
Yeah.
It's a real bother wearing a denture, as you can imagine. This is kind of a little mock-up. Here we have 2 implants. This is the person's mouth. These are 2 implants. We're kind of pretending this is the lower denture.
Okay.
And what happens is this actually just snaps on.
All right.
I mean, you can actually feel it snap.
All right.
And, so if you're in this situation, this is just fantastic. I mean, instead of having something floating around your mouth, you're actually having something click in.
Right.
You can eat better. It
Gives you that confidence again.
Absolutely.
Yeah.
Absolutely.
Yeah. And again, that's just a regular procedure you do every day.
Yeah. Implants are getting big now.
So what new changes in the profession are you excited about these days? Anything else coming up that you see out there?
There's a lot of new technology. I don't have all of them. A lot of them are expensive. There are people in town that have machines that actually make crowns right in the office. It's this like a robotic machine that actually mills stuff right on the spot. There's digital x-rays. There are lasers. There's just all kinds of technologies coming out. And of course, a lot of them are kind of expensive, so not every office has got everything.
Right. Now, I'm sure you have access to all this equipment that you can send the products out to get fixed and then, or made and then back to you.
Absolutely, yeah.
Yeah, and so your turnaround time is probably quite fast on
Yeah,
that. too.
it's quite fast.
Right.
And the dental laboratories have gotten a lot better over the years, too,
Well,
because they're using more high-tech stuff.
That is great. That is great. Hey, it's been a pleasure to be here with you and to interview and be my first interview on my own. I really do appreciate your time. And, we have a lot more to talk about. We'll be right back with Clovis Chamber News and Views with Beth and I, and we look forward to seeing you